What is cancer? Cancer in a nutshell is an abnormal growth of body cells. This can occur in any body tissue. Once the body cells can grow and they can multiply, then cancer can affect those parts of the body. And cancer can affect any person, any age group. There's cancer in children and there's cancer in adults. So cancer is not new. It's not like cancer just started happening in this 21st century that we know. Cancer has been around from before we were born. We have evidence of cancer being in ancient Egypt, even from 3000 BC. They had abnormal growth happening in those persons that time, and even that time they didn't even start having anesthetic at that time. And so those procedures to try to get rid of those abnormal growths were really horrific at that time. So 30% of all cancers have modifiable risk factors. What can we do about it? We can prevent it, or we can detect it early and then treat it early. For prevention, we would deal with our lifestyle factors. We deal with eating properly, healthy diet. We deal with exercise. We deal with having healthy and safe environments. We deal with no smoking and no alcohol drinking, or as limited alcohol drinking as possible. So those are 5 of the major risk factors that they affect all non-communicable diseases, not just cancer, but they affect diabetes and hypertension as well. And so if we can be able to tackle those 5, then we would be well on our way to preventing cancer. So early detection requires us to screen. If we detect early, then we will be able to treat early. Early detection means that we're going to be screening for cancer. For both men and women, we start with breast examination for the breast. That is something that we have control over. So we do our self-breast examination. Women do it, men do it as well, because men have breast tissue. So we examine our breast, use the pads of our fingers. Monthly we check the breast, so we know what a normal breast tissue feels like. So should there be any abnormality, whether in how the breasts look or how they feel, then we know that we are to head straight to a doctor. Sometimes you might find a lump there, depending on what is happening in the breast, but that does not necessarily mean that it is cancerous. However, we should ensure that once this abnormality is felt, we head to our nearest doctor. For cervical cancer screening, we have our pap smear that everyone knows about. And in the southern region, we offer VIAA, which is to check it with a vinegar solution. And that one, with the vinegar solution, you are able to detect cancer changes immediately once on viewing the cervix, and then you will have an immediate feedback. For the pap smear, we would take off a little sample of the cells. We're not pinching off anything. We're just scraping a little of the cells from there, and then we apply it to a slide and we send it off to the laboratory, and that has a more detailed test in terms of what is happening with the cervix. So that's a pap smear. So we offer the HPV vaccine to both our boys and girls in the grade 7 age group to prevent cervical cancer. You might be wondering, why is it that we offer the HPV vaccine to the boys and the boys don't have a cervix? Well, HPV stands for human papilloma virus, and the vaccine is to prevent them from getting human papilloma virus. Why do we give the children at that age group? Because we are hoping that they are not yet sexually active, and so that vaccine would help to provide immunity for the students, especially for the girls at that age group. For our prostate cancer, we have prostate-specific antigen test, which is a blood test that is done, and we also have the digital rectal examination, what we call DRE, that is offered in our clinics. For women who are aged 40 and over years old, for the breast again, then we also advocate and encourage you to have your yearly mammogram done. So for colorectal examination or test, there is a fecal test in which you pass your stool and they test that, and that helps with the screening for colorectal cancer even from before you start having any symptoms where you would have to go and have a colonoscopy done. In the southern region, we have an event that we call the World Cancer Day event. Now, World Cancer Day is celebrated annually right across the world on February 4th. But for our region, we host an event in which we boost our screening. This has been in effect from around about 2016, and what we do, we have an event in which we screen persons with the screening tests that we have available. This year, our event will be held in Manchester, in Mandeville, at the Mandeville Parish Church on the 15th of February. So we invite all eligible persons to come on out and have your screening done, because we will be having pap smear screening, we'll be having screening for digital rectal examination, we'll be having nutrition counseling and those kind of activities that will help to create awareness in terms of cancer and prevention of cancer.